everyone. This is a quick informational video about the tracking and tracing that you hear a lot about going on in the news right now. I got interested in this because I kept seeing Governor Newsom's information and they kept talking about this testing, tracing, and tracking. You can see here they want at least 15 contact tracers per 100,000 residents. So I was curious, what is this? You can see that they had lots of different job descriptions, and these jobs are posted and available now in California and many other states as well. And I've kind of heard it spun that, hey, we're helping give jobs back to an economy that's suffering right now. So these jobs are paying $19 an hour. Clinton even said maybe they can get college credits or college payments eventually for this. So this is something that's kind of gone on through all the different states. But I'm a California girl, so I wanted to focus in on how this is affecting California and what people in California, and a little bit of a broad overview of what the program really entails. This came out recently, and in this part, the gentleman is talking about the tracing and tracking program. Let's listen to what's going to happen if you get found out to have coronavirus.
It's not just our county that's bringing more people on. There are going to be thousands of people hired who will be these contact investigators throughout the state. And this is occurring in many, many other states as well, perhaps all of the states in our country. We will be giving intensive training to these people, training not only for identifying and finding contacts, but also in terms of how to be sensitive about doing it. We also realize that as we find more contacts, some of the people we find are going to have trouble being isolated. For instance, if they live in a home where there's only one bathroom and there are 3 or 4 other people living there, and those people don't have COVID infection, we're not going to be able to keep the person in that home. Every person who we're isolating, for instance, needs to have their own bathroom. And so we'll be moving people like this into other kinds of housing that we have available. They'll also have other needs, perhaps, food, whatever it's going to be. The county will be there to back them up and to support them.
That's pretty scary. And it wasn't a slip of the tongue, because the World Health Organization also referenced the same thing. Let's go ahead and listen to the WHO.
In most parts of the world, due to lockdown, most of the transmission that's actually happening in many countries now is happening in the household, at family level. In some senses, transmission has been taken off the streets and pushed back into family units. Now we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner.
So he's saying he is going to take you out of your home if you get sick. 98% of all cases are mild. So just remember that as we go through this, and that they're talking about removing you from your home. But that's not all that they're removing. This is something from Oregon, and I want you to look at the action required section. Effective 4/22/20, in the course of assessment, a caseworker or supervisor makes a determination that a child will enter substitute care because their caregiver is infected with COVID-19. I am a mother, and nobody would be taking my child if I was sick with COVID-19. But effectively, this is what they are saying. Now, Governor Newsom, I'm going to show you 2 clips about how he talks, and these will be a little bit long. They're a couple minutes each. But listen how he talks about the tracking, the tracing, the amount of people and the isolation of people that may get infected with COVID.
We talked yesterday about new tracing and new technology that we want to put to bear to begin to track, isolate, and quarantine individuals. Tomorrow, we'll have the first cohort of tracers that will start taking our virtual online academy courses in partnership with UCSF and UCLA. We made a final commitment to advance that effort using a new data management platform in partnership with Accenture, Amazon, and Salesforce that will be providing the ability in real time to share information and collect data on a cross-county basis. That is a fundamental part of our efforts to provide not only the workforce 10,000 in phase one, 20,000 within 2 months of tracers, disease detectives, and lexicon perhaps more easily understood, that will be deployed all throughout the state of California. Bottom-up, county-based led effort utilizing the existing workforce of roughly 2,800 or so folks, just shy of 3,000 individuals that are currently doing tracing in the state of California. That augmented resource will allow us to move into this phase with our capacity in real time to determine spread and be able to isolate individuals, quarantine individuals in a way that will allow us to methodically move through this phase into subsequent phases. Remember, deaths, hospitalization, and ICUs are lagging indicators. The more testing we do, our ability to track, to trace, and to isolate and quarantine, that allows us more real-time information that allows us to move into this new phase and stay in that phase in a very, again, judicious and thoughtful way. In addition to that, we're using AmeriCorps specifically, and thank you as a champion for AmeriCorps for decades. We've been able to take advantage of that workforce. Obviously, our conservation corps, what we have now is called Cal Volunteers. In the spirit of Sarge Shriver, we are asking people, thousands of folks, to be part of this new corps, to get trained and to help us with the tracing, because you're absolutely right. The predicate for getting back to some semblance of normalcy is our ability to identify individuals through testing, to be able to trace their contacts, to isolate individuals that have either been exposed or quarantine people that are tested positive. And that's just going to require an army of folks and the capacity of consideration from individuals to allow for their privacy to be impacted by that kind of acuity of attention based upon where they've been and who they talk to.
When I talk to many people, they say, well, really, they don't have a right to do that. So they can think they have a right, but that it really isn't true. But if you look at this, you can read that it states the local health officer may take any action. This AB 262 really gives a unilateral blanket authority to health officers. This stops any of the doctor-patient confidentiality. All those numbers will be given to the government. This really takes away any of your privacy and any of your rights if you are traced. What they're going to say, and what really the next step, and this is what they're doing in the UK, is they are going to have a tracing app that you are going to have to put on your phone. And they're going to make this required to go back to work, for things to go back to normal, so that they can track and trace you. I want you to listen to this gentleman from the UK. He's going to talk a little bit about how the tracing and tracking works.
Islanders will then be asked to install the app. Once you've installed the app, it'll start logging the distance between your phone and other phones with an app nearby. It's been designed with a form of Bluetooth that conserves power so the app won't drain your battery, and this log of proximity information will then be securely stored on your phone. If you become unwell with COVID symptoms, you inform the NHS via the app. Other app users who you've had significant contact with in the last few days will then be sent an alert by the NHS along with advice about what to do. A test ordering function will then be built in. If you're watching this and you live on the Isle of Wight, I have a simple message. Please download the app to protect the NHS and save lives.
So basically, if you have COVID, they're going to take your cell phone and they will know all your movements and anybody that you have been connected to, and let them know that they need to isolate and things that they need to do. Pretty scary stuff. So out of curiosity, it's May 6th, and these numbers obviously can change. I wanted to see, well, really, how many of these Californians are really coming down with coronavirus? I know 0 people. I know there's some out there, but it seems very small. So what I did is I pulled up the information, and I want to show you where I got this. I got this from Worldometer. I feel like their numbers are pretty good. They document really everything. I just did a basic Google search for California population to kind of give me an overall number. So we've got 39.5 million. I took those numbers. So our coronavirus cases, out of 39.5 million, there's 60,595 cases. That's 0.1534%. 0.153405%. What are my chances of dying? 0.006228%. This seems like a lot of tracking, a lot of tracing for a small amount of number of people infected. COVID is scary. People have been nervous about it. But let's look at really in California, the closest numbers I can get were from 2017. How many people are really dying and how many people die per day? Because to be honest with you, I never looked at death numbers. Now daily I'm getting how many people are dying, the cases that are dying, and I was never really aware of really how people died in California or really the United States. But what I did here is I pulled up the leading causes of death, and this is 2017. This is the best I could get. I took those numbers of death, so like heart disease is number 1, and I took that number, I divided it by the amount of days, and so how many people per day truly die of that. And then I took 127 days, basically just taking it from May 6th to just get an idea. Obviously, it's not directly proportional, but kind of where we were in terms of all the people dying from January 1 to May 6 to make it relevant to the COVID numbers that we're getting. And you can see here, we're at 2206 for the flu, usually, and diabetes. Now, the coronavirus right now, it fits the middle of this. We've never done this kind of tracking or tracing for the flu. And I've heard it's much worse than the flu, and it's deadlier than the flu. But right now in California, it truly is not much more deadly. Actually, the CDC came out with something recently, and I'll point that out too, basically stating that the numbers were very much the same point as where they were in terms of the flu. Let me pull that report up really quickly. Okay, so I just pulled up the CDC website, and you can see here, if you want to pull it up yourself, it's under key points, but basically it talks about different hospital rates, and it says hospital rates for COVID-19 are higher than hospital rates at influenza during the past 5 seasons. It says for people 65 and older, current COVID hospitalization rates are similar to those being observed during comparable time points during recent high severity flu seasons. For children 0 to 17, COVID hospital rates are much lower than influenza hospital rates during recent flu seasons. So my question is, we are doing a lot of extra work for a number at this point that is necessarily not that high, and I'm giving up a lot of my rights in terms of privacy for something that's falling right between the 7 and 8 in terms of the daily death rate. And I've never seen this kind of tracking for the flu, let alone for sexually transmitted diseases. And that brings me into the HIV. So HIV, California has some laws about privacy for somebody who's infected with HIV. And what you'll see here is that this talks about the California's constitutional right to privacy. It's even broader than the federal constitutional right. So you don't have to disclose if you have HIV to an employer. You don't have to disclose it to anyone because it's a highly protected. So there's very few reasons that you would have to disclose that you have HIV, which of course seems in line. It's not anybody's business. It's your own privacy. And there's not very many laws against it. Right now in California, if you knowingly infect somebody, you give blood to somebody, guess what? It's not even a felony. Even though you knowingly infect them, it's a misdemeanor. It's not even really tracked. So we give someone with HIV a lot of privacy. We don't track them. It's even a misdemeanor to knowingly infect them. And that's fine and good, but why is COVID so different? Why are we tracing people down, tracking them, and giving out privacy? Now, what I would prefer is that they track the 3,500 inmates that have just been released from the coronavirus, already committed new crimes, and those even include murder. Track them, trace them. Let me show you how China removed people that had COVID-19 from their home. Hopefully this gives you an overview of what the tracking and tracing really is, and you understand it when you hear our governor talk about it, and how scary this is, that we are giving up our rights for something that truly, at this point, is not infecting much of our population. Stand up for your rights. I'm embarrassed because a lot of these laws were passed under my nose and I didn't take an active interest. So that's why I'm sharing this with you, hoping that you learn something and take an active interest in stopping the tracing and tracking team that is coming your way. Good luck, everyone. God bless America.